بسم الله الرحمن الرحيم. اليوم محاضرة عن actinic keratosis or solar keratosis. Actinic keratosis represent in situ dysplasia resulting from sun exposure. They are found chiefly on the chronically sun-exposed surface of the face, ears, balding scalp, dorsal hand, and forearms. They are usually multiple, discrete, flat, or elevated verrucous, or keratotic, red, pigmented, or skin-colored. Usually the surface is covered by an adherent scale, but sometimes it is smooth and shiny. شوف ذاك صورة، هذه صورة، هذه actinic keratosis، هذه another picture. On palpation, the surface is rough like sandpaper, and at times the lesions are more easily felt than seen. The patient may complain of tenderness or bleeding when the lesion is wrapped or shaped over with a razor. The lesions are usually relatively small, measuring 3 mm to 1 cm in diameter, most being smaller than 6 mm. Rarely, the lesion may reach 2 cm in size, but the lesion larger than 6 mm should be considered actinic keratosis only if confirmed by biopsy or if it's completely resolved with therapy. يعني إنه عادة هو أقل من 6 ملم، فإذا كان أكثر من 6 ملم لازم نكون متأكدين أما عن طريق البيوبسي أو عن طريق استجابة التريتمنت. The hypertrophic type, which may lead to cutaneous horn formation, is most frequently present on the dorsal forearm or and hands. Actinic keratosis are most common epithelial precancerous lesion. Although lesions typically appear in the persons over the age of 50 years, actinic keratosis may occur in 20s or 30s in patients who live in an area of high solar irradiation and have light skin tone. Patients with actinic keratosis have propensity for development of non-melanoma skin cancer. Actinic keratosis should be prevented by regular application of sunscreen and low-fat diet. البيتا-carotene is of no benefit in preventing actinic keratosis. بس ممكن اللي يفيده هو sunscreen and low-fat diet. Nicotinamide has also no benefit, but can help prevent non-melanoma skin cancer, not seborrheic keratosis, not the actinic keratosis. Histopathology, skin types of actinic keratosis can be recognized histologically: hypertrophic, atrophic, paunoid, acantholytic, pigmented, and lichenoid. The epidermis may be acanthotic or atrophic. Keratinocyte maturation may be disorders with overlying parakeratosis. Sometimes present parakeratosis نعرفها اللي هو hyperkeratosis with preserved nuclei يعني abnormal. The basal cell are most frequently dysplastic, and although those with more advanced lesions, dysplasia may be seen throughout the epidermis, simulating Bound disease, paunoid actinic keratosis. Differential diagnosis. The clinical diagnosis of actinic keratosis is usually straightforward. Early lesions of chronic cutaneous lupus erythematosus, erosive pustular dermatosis of the scalp, and pemphigus foliaceus are sometimes confused with actinic keratosis. Seborrheic keratosis, even when lacking pigmentation, are usually more stuck on in appearance and more sharply marginated than actinic keratosis. Dermoscopy aids in this distinction. It is difficult to distinguish hypertrophic lichen planus from early squamous cell carcinoma, and a low threshold for biopsy is recommended. Similarly, actinic keratosis, which present as a red patch, cannot easily distinguish from Bound disease or superficial basal cell carcinoma. Biopsy should be considered if there is a palpable dermal component. Purely إنه إيش وقت يعني إنه لازم نسوي biopsy when there is a palpable dermal component and هذا يصير infiltration. Purely quality when stretching the lesion. Any lesion larger than 6 and those that fail to appropriate therapy for actinic keratosis should be carefully evaluated for biopsy. هذه الصور شفناها. treatment. Because some percentage of actinic keratosis will progress to non-melanoma skin cancer, their treatment is indicated. There are many effective therapeutic modalities. Cryotherapy with liquid nitrogen is most effective and practical when there are limited numbers of the lesions. A bulky cotton applicator dipped into a liquid nitrogen or handled nitrogen spray device can be used. إذا أما إنه يعني إنه السبراي نستخدم أو نستخدم يعني الكوتن applicator dipped in liquid nitrogen بالسائل مع النيتروجين عن طريق الكوتن applicator. If cotton applicator method is used, the liquid nitrogen into the applicator is dipped should be used only for one patient because there is theoretical risk of cross-contamination from one patient to another. يعني السائل اللي دا نستخدمه البيشنت معين دا نخلي بيه القطن هذا ممكن إنه يسوي contamination هذا القطن لما دا استخدمه من المريض يعني القطن لما دا داخله بالسائل السائل ممكن يصير بيه contamination فالسائل يستخدم المريض واحد. Infectious agents are not killed by freezing, so many dermatologists now use the spray device. The authors recommend using a small opening tip with continuous bursts of nitrogen spray in circular motion depending on the size of the lesion, attempting an even frosting. يعني عادة إنه نستخدم small opening tip بالسبراي حتى إنه not damage the surrounding skin. أو ممكن نسوي أكثر من circular motion أكثر حد ما إنه يعني الليجن نحوط الليجن كله. Only the lesion should be frosted, and the duration of cryotherapy must be carefully controlled. A long freeze that results in significant epidermal dermal injury produces white scar, which may be easily seen. When correctly performed, healing usually occurs within 1 week on the face, but may require up to 4 weeks on the arms and legs. Caution should be experienced when treating the below knee because when the healing in these lesions, particularly bore and chronic ulcers, can be seen. Although caution is required in the person with the risk of having cryoproteins such as hepatitis C virus infected patients and those with connective tissue disease or lymphoid neoplasia may have excessive reaction to cryotherapy. هم أصلا patient اللي عندهم cryoprotein اللي هو precipitated when the patient exposed to cold or in a cold condition. فبالتالي أنا يوم أعرض cryotherapy ممكن إنه أسوي له risk precipitation of this cryoprotein والcomplication مالتها. منهم البيشنت اللي عندهم cryoprotein اللي هم hepatitis C, connective tissue disease or lymphoid neoplasia. It is better on the first visit to undertreat until the tolerance of the patient's skin to cryotherapy is known. أفضل ما إنه يعني شلون over treatment ممكن يسوي له scarring يسوي له injury وscarring. الأفضل إنه under treat لحد ما أشوف استجابة البيشنت. Application of 0.5% 5-fluorouracil for the 4 week before cryotherapy improve response. For extensive, proud, numerous lesions, topical chemotherapy is recommended. Biopsies should be taken of any lesion that could represent an non-melanoma skin cancer before beginning the topical chemotherapy or photodynamic therapy for actinic keratosis. The two agents most frequently used are 5-fluorouracil cream or 0.5 to concentration مالته يكون 0.5 to 5% or in commode ممكن 2.5, 3.75 or 5% cream. Topical tretinoin and adapaline do not have the efficacy of these two agents, but can be used for a prolonged period and represent an option for the patient with a few early lesions. ممكن patient اللي few early lesions نستخدم إله بس مو نفس الافيكاسي مال 5-fluorouracil and Incomod. They are also useful pre-treatment of hyperkeratosis lesion before the course of 5-fluorouracil. Terpanypulin ointment 1% is a SRC kinase agent inhibitor that I use for 5 consecutive days. ممكن نستخدم هذا الأوينتمنت. Also 3% diclofenac اللي هو يجي بشكل جل in 2.5 أو أوينتمنت يعني 2.5% hyaluronic gel هنا ممكن أو 3% اللي هو من جماعة النون ستيرويدال anti-inflammatory drugs. نستخدمه for 60 days أو 0.5 piroxicam هذا أيضا من جماعة النونسترودل for 6 months with a sunscreen is also effective. Topical resiquimodes and genol butyate are also effective therapeutic options, and the trichloroacetic acid pills may still be useful for some patients. The inflammatory reaction with these agents parallel efficacy, but some data suggest that toward less irritation without diminished efficacy if dimethicone lotions is applied before genol or genol mutate. The frequency and the duration of treatment are determined by individual's reaction and the anatomic site of application. 5-fluorouracil is applied once daily in most cases. For 5% for face, 0.5 to 5% of fluorouracil tend to give predictable response, which is slightly less severe than those produced by 1 to 5% concentration. فنستخدم 0.5% لهذه السايتس. Some patients prefer stronger concentration for the barrier pre-fear periods, whereas others have favor slower onset of reaction and more prolonged course. فبالتالي نحدد الكونسنتريشن على أساس اللي يريد استجابة أسرع ممكن concentration عليه، بس اللي يريد slower onset حتى إنه ما يصير عنده reaction ممكن بس يحتاج prolonged period. For 5% cream, treatment duration rarely exceed 2 to 3. While for 0.5 treatment course is 3 to 6 weeks. Usually, the central face will respond more briskly than the temples and forehead, which requires a longer duration of treatment. If the reaction is brisk, mid-citronate corticosteroid ointment can be helpful, or treatment should be stopped and restarted at lower concentration. ممكن نستخدم corticosteroid أو نقلل concentration مع الدراج. Depending on the individual sensitivity, erythematous burning reaction will occur within several days. The treatment is stopped when peak response occur, characterized by change in the color from bright to dusky red, re-epithelialization, and cross formation. Healing usually occur within another 2 weeks of stopping the treatment, depending on the treatment site. Certain areas of the face are prone to intense erythema dermatitis when exposed to 5-fluorouracil, and tolerance can be improved if the patient avoid application to the glabella, myelolabial fold, يعني nasolabial fold, and chin. For the scalp, the 0.5% concentration may be adequate, but prolonged multiple treatment courses often are required if there is if this low concentration is used. The 5% cream produces a more predictable although brisk reaction. A thick cutaneous horn can prevent penetration of 5-fluorouracil, and hyperkeratotic seborrheic keratosis of the scalp, dorsal, hand, and forearm may respond poorly unless the area is pre-treated with agent that remove excessive keratin overlying the lesion. يعني الاريا اللي بيها هواي كيراتين صار الليجن بهواي كيراتينز ممكن إنه نستخدم كيراتونيليتيك بالبداية على مود التريتمنت يصير له penetration للليجن. Pre-treatment with tretinoin for 2 to 3 weeks can improve the efficacy and shorten the duration of subsequent 5-fluorouracil treatment. It has been observed that 5-fluorouracil seek out lesion that may not be clinically apparent. يعني إنه إذا خلينا ال 5-fluorouracil على area ممكن إنه الليجن ما واضح حيل. ال 5-fluorouracil عنده tendency إنه يعني يشتغل أكثر على affected area. The use of topical 5-fluorouracil to the face can reverse photoaging. Clinically, inapparent basal cell carcinoma can be detected during or on completion of the treatment. Rarely, the patient have multiple courses of 5-fluorouracil topical chemotherapy will develop a true allergic contact dermatitis. بس هذه يعني نسبة rare. This is manifested by redness, edema, vesiculation extending beyond the area of application, or by the patient developing pruritus rather than tenderness of the affected area. Part testing can be confirmatory للallergic contact dermatitis. Imiquimod is an interferon inducer and eradicates actinic keratosis by producing local immunological reaction against the lesion. The ideal protocol for application of imiquimod is not yet determined. About 80% of patients respond to imiquimod and 20% not respond at all, perhaps because they lack the genetic component required to induce inflammatory cascade when imiquimod is applied. يعني البيشنت هذول ممكن هم عندهم اصلا genetic يعني lack genetic component اللي الاميكومود يشتغل من خلاله حتى يسوي هذا الرياكشن. When 5% imiquimod is applied 3 times a week, patient develop an inflammatory reaction similar to that seen with daily application of 5-fluorouracil. The severity of the reaction is somewhat unpredictable, with a small subset of patients, especially fair-skinned women, develop a severe burning and crusting reaction after only one or few applications. In others, no reaction at all. With a twice weekly application, the treatment course is prolonged up to 16 weeks. Severe erythema occur in 17% and scrubbing, crusting in 8% of patients so treated. The median percentage reduction in actinic keratosis is 83 with this treatment protocol. However, 7% treating with actinic keratosis on the arms, hands, and with imiquimod 3 times per week achieved complete clearance. هسه الريسبونس يصير ب 7% complete clearance. Applying it more frequently lead to increased toxicity. Overall, although the reduction is less predictable with imiquimod, it's also typically less severe than those with high concentration of 5-fluorouracil يعني reaction أو side effect مالته. The adverse event rate are similar to those of low concentration of 5-fluorouracil. يعني adverse event of imiquimod مقارنة بال high concentration 5-fluorouracil أقل، بينما بالlow concentration 5-fluorouracil تقريبا the same. Another regime is to apply the imiquimod for a long period at reduced frequency once or twice weekly. Application can be alternating 1-month cycle or continuous for many months. This may allow management of patients who require treatment but cannot tolerate any significant change in appearance, may lead to severe reaction surrounded. Imiquimod 3.75 and 2.5 are used daily for 2 weeks, with 2 weeks off, and then for 2 weeks again, with good efficacy and fewer side effects. Ultimately, the choice between topical 5-fluorouracil and imiquimod will be based on patient preference, prior physician and patient experience with the modalities and the cost. Imiquimod is significantly more expensive per gram than 5-fluorouracil. A meta-analysis comparing efficacy studies of 2 agents dosed in various concentrations and regimes suggests imiquimod have a higher efficacy for actinic keratosis on the face and scalp. إذن هو higher efficacy أقل ممكن side effect مقارنة بالhigh concentration of 5-fluorouracil, but more expensive. A recent هاي واحدة من studies. A recent Cochrane's review concluded that 5-fluorouracil, imiquimod, ingenol, miputate, and diclofenac acid are similarly in efficacy, but have different adverse event and cosmetic outcomes. Direct comparative trials between these agents would be of great value in determining the optimal and most cost-effective strategy for treatment of extensive actinic keratosis, and the cost of the treatment can vary widely depending on the modality chosen. Surgical management of actinic keratosis with a chemical peel, laser resurfacing, and photodynamic therapy discussed later. هذا فيما يخص actinic keratosis.